live. Hello, everyone, and welcome to the Embracing Diversity LGBTQIA Protections Virtual Program. Before we get started, I'd like to go over a few housekeeping items so you all know how to participate in today's event. The views and opinions of today's speakers do not necessarily reflect the views and opinions of the New Jersey Division on Civil Rights. This program will be recorded. Given this is a webinar, guests will not be able to be seen on camera. Nonetheless, as an audience, you have access to drop questions in the Q&A tab, and you have the option to submit questions anonymously. All audience members, cameras, and microphones will be off as well. Due to time constraints, please keep all questions on topic. Please note that questions we do not get to this evening will be answered as a follow-up after the event. You may also email us at communityrelations@njcivilrights.gov. Resource links and contact information will be shared in the chat throughout the program. If you experience any technical difficulties tonight, please explain your problem through the chat feature, and we will try our best to address the issue. Lastly, please follow the New Jersey Division on Civil Rights on Facebook and Twitter at, Civil Rights NJ for the latest information on news, resources, and information from our office.
Thank you, Patricia. Good evening, everyone, and thank you for joining us. June marked the 53rd anniversary of Pride, a protest and celebration born from the birth of the modern LGBTQ movement in New York City in the late 1960s. The movement for LGBTQ rights in the United States, however, began decades before and continues today. According to the United States Office of Disease Prevention and Health Promotion, LGBTQ folks face significant health challenges as a result of social stigma, discrimination, and violence. On a national level, we've seen almost 400 anti-LGBTQIA+ bills introduced. Contrary to the national landscape, in New Jersey, we have the New Jersey Law Against Discrimination that protects against discrimination and bias-based harassment for many protected classes, including sexual orientation, gender identity, and gender expression in the areas of employment, housing, and places of public accommodation. In the first 6 months of 2022, there have already been 231 LGBTQ bias incidents reported to state and local law enforcement in New Jersey, compared to 365 total reported in 2021 and 192 reported in 2020. Tonight, we will take a closer look at what discrimination and civil rights violations could look like and how they impact the LGBTQIA+ community. We will also discuss some of the barriers LGBTQIA individuals face and resources to address and overcome such barriers. Finally, we will talk about the protections in employment, housing, and places of public accommodation based on the protected characteristics of gender identity, gender expression, and sexual orientation afforded under the New Jersey Law Against Discrimination. And to join us in this conversation will be our panelists this evening. Iris Bromberg, a legal specialist in the New Jersey Division on Civil Rights, Strategic Initiatives and Enforcement Unit, where she works on proactive initiatives aimed at enhancing the civil rights and preventing discrimination. She leads SIE's Fair Chance in Housing work and co-leads SIE's Gender Equity and LGBTQ rights work. Garden State Equality Executive Director, Christian Fuscarino, has deep roots in New Jersey. Growing up in Belmar and spending much of his youth in and around Asbury Park, Fuscarino has been an activist and an organizer in the LGBTQ community for over a decade. He credits his positive experiences in Asbury Park as helping influence him to become an activist. H. Craig Cutler is the founder and president of Equality Mental Health LLC, a dedicated practice for the LGBTQ community in River Edge, New Jersey. Craig is an experienced licensed clinical social worker and certified psychoanalyst and has been in private practice for over 20 years. And finally, JP Bedetto is a proud trans man and social worker. JP began socially and medically transitioning in 2018, and since then has been sharing his transition on social media as an LGBTQ educator and activist. JP is the program coordinator and clinician for Family Connections Pride Plus, a program that provides a safe space for middle and high school age youth that identify within the LGBTQIA plus community. Please note, tonight's agenda and full biographies for each panelist will be dropped in the chat and included on the DCR website. Thank you, Christian, Iris, Craig, and JP for joining us tonight. Let's jump right in. Christian, what are some of the challenges that LGBTQIA folks still face?
That's a great question. I just want to start by saying good evening to everyone that's watching, and thank you so much to the New Jersey Division on Civil Rights for hosting this important conversation. As I'll talk a little bit about right now, the LGBTQ community is still facing some incredible barriers and challenges to equality. We're so glad to be included on this panel, especially among esteemed panelists who are doing incredible work here in the Garden State. So listen, if this question was asked 6 months ago, I would answer, very plainly on the issues that we're facing as a community. One important note that I need to point out at this point is, these barriers and challenges that we're facing are very real and life-threatening. And yet at the same time, we need to fight the battles that we've already fought, because we see that the US Supreme Court is potentially going to roll back marriage equality. And so a battle that a lot of time was spent on, a lot of lives were lost on, a lot of money was spent on. Here we are in a position where we're debating whether or not two individuals can love and marry one another. And that's just sad. But I'm going to assume that everybody watching this evening knows about the importance of marriage equality. And I want to talk about some issues that you may not be familiar with. And that's issues like housing, employment, homelessness, mental health, issues that Garden State Equality is working on here in New Jersey alongside the Murphy administration and with the pro-equality legislature. So to start, let's just talk a little bit about those that are most vulnerable in our community, and that's LGBTQ youth. For those that are unaware, LGBTQ youth represent nearly 40% of the entire youth homeless population. And so what does that mean visually? If you know of a homeless young person, there's nearly a 50% chance that they identify as LGBTQ. And more often than not, it's because their parents or their guardians have kicked them out of their homes simply because of who they love or how they identify. We saw rates of homelessness increase during the COVID-19 pandemic and lockdown, because all of a sudden, a lot of young people were spending a lot more time with their parents and getting to know each other a lot more than they thought they did. And unfortunately, even in the middle of a health pandemic, we saw parents kicking their children out of their homes simply because of who they are. And it's devastating. Here in New Jersey, we have 18 beds, only 18 beds that are specifically designed to cater to the LGBTQ community, especially the trans community. And that organization is the RAIN Foundation, located in East Orange. There are other shelters that, of course, welcome the LGBTQ community, but those are specifically, that is a specifically designed shelter for the LGBTQ community. Another thing that is affecting LGBTQ youth is high rates of bullying in schools. Unfortunately, we know that LGBTQ youth face some of the highest rates of bullying in schools. This is not news to anyone that's ever been through school. It's a tough place to be, and even more so if you're LGBTQ. That's one of the reasons that we passed the LGBTQ inclusive curriculum law here in New Jersey, because we know that when schools are teaching diverse and inclusive lessons, rates of bullying drastically decline. And then the other area I just want to mention about LGBTQ youth that we can go in through a little bit later, and I'm sure panelists will talk about, is adverse childhood experiences in mental health. New Jersey is leading the nation on addressing ACEs. And that's great news for the LGBTQ community, because just like the other items I've talked about, LGBTQ youth experience some of the highest rates of ACEs. Some of the other issues that are facing our community that we're working on right now is issues of employment. You're going to notice a trend here where we represent some of the highest rates in every category. Our community does, and for unemployment, trans women of color represent the highest rates of unemployment. And so how are we addressing that? Well, we need good policies. So earlier this year, the governor signed an executive order that will expand the contracted services and prioritize LGBTQ-owned businesses. That's great for trans-owned businesses. We need to make sure that we have good workforce development training, and we're working with some corporate partners in the state to develop that development training. And we're ensuring that any government-facing entity that helps people get employment, whether in the state government or private sector, is targeting these communities to ensure that those opportunities are there for them to get employment. And then the one other area that I'll mention is the older adults community. Here in New Jersey, we did a statewide needs assessment to see what it's like to be an LGBTQ older adult in a long-term care facility. And unfortunately, just like all the other data points I've been mentioning, LGBTQ older adults face some of the highest rates of abuse in long-term care facilities. How are we addressing this? Here in New Jersey, we passed the LGBTQ older adults Bill of Rights, which requires long-term care facilities to undergo sensitivity training to better interact with and treat LGBTQ residents. It's still too early to see if that has changed the data that we did from the needs assessment. But just if this is the first time you're hearing about this, just take a moment and think. A lot of times these are individuals who have spent their entire lives fighting for the rights of our community. They become more vulnerable and they need to move into an older adult long-term care facility, and they're treated with abuse. The folks that are there to feed them, clothe them, bathe them, take care of them are mistreating them simply because of how they identify or who they loved or love. And so the work continues on all fronts in what we need to do to continue to move equality forward in New Jersey.
Thank you, Christian. And that was a powerful answer. I want to move on to Craig. And Craig, can you talk to us about the impact that discrimination, harassment, and bullying has on mental health?
Sure, I'd love to. Thank you so much for asking me to be on this panel. It's a real honor. And I'm going to expand on what Christian was talking about earlier and talk about healthcare and mental health care. And as we know, all people need medical care, all people, and yet for the LGBTQ plus community, basic and essential health care can be very difficult to access. Stigma, bias, and systematic inequalities in healthcare can hinder our ability to receive appropriate treatment and care. And for people of color, people who are gender nonconforming, and for people who are HIV positive, the challenges can be greater, particularly for those people who live in more rural areas. As we know, LGBTQ plus people frequently avoid or they postpone healthcare because they don't imagine that they're going to be well received or get appropriate care. And being turned away because of perceived or actual gender or sexual orientation can exacerbate existing health problems. More often, the larger problem is that there are an insufficient number of available providers, especially those who are well-trained in LGBTQ plus health. Another area, and Christian, you were referring to healthcare facilities, and not an uncommon problem. There are some healthcare providers who refuse to touch LGBTQ plus patients, or they use excessive precautions. One example might be a patient who is HIV positive might be handled with double or triple gloves. Meanwhile, their roommate lying right next to them, there are no gloves that are utilized. Another issue is being handled roughly or aggressively, or another problem is the engagement in unwanted physical contact. Using harsh, abusive, or disrespectful language is not unheard of. Blaming patients for their healthcare conditions or their healthcare status is problematic. Misgendering patients or using the wrong names or the wrong pronouns happens all too often. Not recognizing family, including a child or a same-sex spouse or partner, is also problematic. And as we said before, there are healthcare providers who are not knowledgeable or sufficiently trained in providing services to the LGBTQ plus community. Unfortunately, the most vulnerable usually have the poorest and the least access to quality care. And in terms of mental health, we know right now for everyone, there's a lack of available mental health providers. It's very difficult to obtain an appointment with a therapist or a psychiatrist. Waiting lists are not unheard of. Right now, if you're trying to make an appointment with a psychiatrist, there may be at least a 2-month or longer waiting list. Very often this leads to a decompensation, and it may require the patient going to the emergency room and or having psychiatric hospitalization, which could have been well prevented. Another area, there are many well-meaning mental health therapists, but many are insufficiently trained. One of the areas that I'm particularly concerned about is incorrect or improper diagnosis, inadequate or substandard care, and a lack of trust of medical and mental health providers based on historical and or personal experiences. This results in delays in treatment, poor treatment outcomes, including dropping out of treatment, and this has a negative effect both for the patient and for the family and loved ones. So how can we respond to this? The obvious is better training and better awareness. This includes better training for medical students, medical residents, continuing education for established medical and healthcare professionals. Medical research has to be inclusive of LGBTQ plus people. We need to advocate for better laws and policies, particularly the policies. We're pretty good in New Jersey with our laws. It's the actual implementation that sometimes is problematic. We need to file formal complaints to organizations and people in charge to let them know about mistreatment, abuse, prejudicial attitudes and behaviors. And we also need to use existing medical power of attorney and other legal documents to provide as much protection as possible. You had asked, what impact does this have on the psyche, on the psychology of a person? When we are faced with mistreatment and abuse, this is an assault on the sense of self, right? And if you're trans, this is an annihilation of the self. And it means that we have to give up parts of ourselves in order to maintain our sense of security. So this means that parts of ourselves need to be compromised or hidden from other people. And that's a really high price to pay, an unnecessary price, but it has a very deleterious effect when the message that we receive is that we are not acceptable to others, that we have to change who we are fundamentally in order to be well treated. This would very much lead to high levels of depression and anxiety, and anger turned inward actually turns to depression, as we know. And so we either have to cut off parts of ourselves, or we have to cut off our feelings, and we would call that dissociation, which is not a good thing to have. Neither is a positive outcome. So with time, courage, and support, we need to find another person, an organization to attach to where we can be fully accepted, and we all need to belong. Our sense of security is based on a sense of belonging.
As you're talking about the impact that discrimination and harassment and bullying has on the individual and the psyche, what are the best ways an individual can help someone in this space?
Sure. Well,
I'm sorry, let me rephrase. How do we know if a loved one is suffering from a mental health problem, and how do we support them?
Okay, that's a great question. So I wanted to talk about that. What are some of the signs and symptoms that someone's suffering from a mental health condition? So some of them might be obvious and some of them might be more subtle. So I'm going to go over a few of them. Some typical ones include feelings of sadness or feeling down for a prolonged period of time, excessive fears or worried, a reduced ability to concentrate, extreme mood changes of highs and lows, significant fatigue, low energy or problems sleeping, feeling detached from reality, an inability to cope with daily problems or stress, trouble understanding and relating to situations and to people, using excessive alcohol or drugs to cope, major changes in eating habits, changes in our sex drive, excessive anger, hostility, or violence, having suicidal thinking. These are symptoms that need to be taken seriously. These are not symptoms that just go away by themselves. They need to be addressed. The sooner, the better. And the best way we can get help for ourselves is to talk about it with the people who we know, and that includes our loved ones, our family. We need to also reach out to our primary care physician. These are people who can help. And if someone you know tells you that they're experiencing difficulty, take them seriously. Do not dismiss it. Do not discount it. This is important. This can be life-threatening. So you need to get help for yourself. And fortunately, we have some fantastic providers here in New Jersey. You just need to find the ones who are going to be able to support you and understand you.
And I just have one follow-up question to that.
Mhm.
What if the individual doesn't have a primary care provider or a physician?
Okay. Then think about the people in your support system. That could be a, a spiritual leader. It could be a colleague at work. It could be a next door neighbor. You need to talk about it. Talking about it is one of the ways that we reduce mental illness. Sitting in silence exacerbates mental illness. So the way we help ourselves and we help others is to talk about it. We reduce shame, we reduce stigma. We need to communicate that it's okay not to be okay. We all go through periods like this, and it's important to acknowledge that and to help someone to get the help that they need. There are always people available. There's now a 988 number, which is a federal line. It's a suicide and crisis line. Rutgers University here in New Jersey is handling many of those calls. In every county, there's a mental health center. It's called New Jersey Mental Health Cares, and that phone number is 866-202-HELP. For police officers, there's a special line, cop to cop, and that's 1-866-COP-2-COP. Those are some resources that people should access. If the problems intensify and there are safety issues, someone needs to go to their local emergency room, and hopefully a loved one will go with them.
Thank you so much, Craig. That is a lot of helpful and insightful information. I want to pivot a little and talk about some of the barriers that non-binary and transgender youth are in particular facing. Christian, JP, can you talk to these barriers?
Of course. Thank you so much for having me tonight. I'm really excited to be here. So I think my other panelists have done an excellent job talking about barriers that the LGBTQ community faces, but there are specific barriers that non-binary and trans individuals face. So just taking a step back, for anyone that doesn't know, the term transgender, it's an umbrella term used to refer to individuals whose gender identity, which means their internal sense of their gender and or their gender expression, how they choose to display their gender identity to the world, differs from the sex they were assigned at birth. Now, transgender is a huge, huge term, umbrella term, that, you know, there's all different peoples that identify as transgender. Some identify within the gender binary, basically the belief that gender is broken down into two categories, male and female. Those people would refer to themselves as trans men and trans women. And there's also transgender people who identify outside the gender binary. They could be non-binary, gender fluid, gender queer individuals. So, you know, it's really important to understand that the word transgender means different things to different people. And, you know, not everyone's transition looks the same, is the same journey. So for me, I can speak on my personal experience, but that could be very different from another transgender individuals. The issue and barriers that they are facing in particular, in addition to all the ones that the panelists have already talked about, a big one is simply healthcare. Okay, so non-binary and transgender individuals, for some people, part of transitioning is a medical transition. So that might look like being on hormone blockers or starting hormone replacement therapy. It could mean gender affirming surgeries. It depends again on the individual. Not every trans person is the same, or not every transgender individual feels the need to undergo medical transitions. But as we're seeing in the world, and I'm so glad, Christian, you started off talking about this, we have a lot of issues coming up right now, and it doesn't take long to realize that there's a lot of backlash against this community, especially the trans and non-binary community, and even more especially when it comes to youth. People don't think children should be on hormones or puberty blockers or have surgeries without really having an understanding of what that means. There's a lot of lack of education. There's a lot of misinformation being spread. But non-binary and transgender youth really face barriers getting the medical care that they need. And it's oftentimes that they have to teach their healthcare providers how to treat them. And that's really unfortunate. And it's really difficult that youth are not being taught in schools about themselves. There's often not conversations about what it means to be transgender or support in schools. So they're turning to the internet to find resources and having to teach themselves about who they are, their options, and then having to go and teach healthcare professionals, mental health professionals, how to treat them as well as teaching their families. So it's a big burden that gets placed on non-binary and transgender youth. Other things is sometimes transgender youth would like to change their name or change their gender marker. So there's a lot of legal barriers that come in with that. Sometimes with schools, it could even be as simple as not having the right to go to the bathroom in the bathroom that they want. They might face backlash from students, from teachers, from parents in the community. And we'll get into this a little bit later about your rights in the school, but just some barriers that they might face. Simple things like going to the bathroom or being called the name you'd want to be called or the pronouns you'd want to be referred to are major barriers for non-binary and transgender youth. Christian, if you wanted to add more to that.
I think you covered it. I think you covered it pretty well. I think just like one thing I will add is for folks who are not aware of all the barriers that were just expressed, at the same time, being a young person going to school and wanting to learn, there are adults trying to legislate their lives away. Nearly every state across the country has had some version of an anti-trans bill introduced over the last 5 years. And so they deal with the pressure from that too. They are young people watching the news and hearing about these grown adults trying to legislate their rights away, trying to make them invisible, trying to say that they don't matter. And so as if the in-person stressors in life and all the barriers that they have to face personally isn't enough, they then turn on the news at the end of the night and they see these folks, spewing hateful things and misinformation to try to take away their rights. And so, if you have the resiliency as a young person, which thankfully trans youth are some of the most resilient people that I know, and you're able to overcome all the barriers that are presented before you, you still have the uncertainty of the future and what the world is going to look like because of these laws being introduced. And so we as LGBTQ people, we as cis people, we as allies to the LGBTQ community need to do everything we can to combat that hate, to combat those pieces of legislation. And really, honestly, the goal should be that they never see the light of day. Because here in New Jersey, anti-trans legislation against trans youth was introduced, and youth were reaching out to Garden State Equality concerned this was going to become law. They didn't understand that just because a piece of legislation is introduced doesn't mean it's ever going to become law, which thankfully here in New Jersey, at least under this Murphy administration and with the pro-equality majority legislature that we have, we know for certain that those bills would not ever become law. They're just not enough votes that exist right now. But for a young person, they see that it was introduced and they think it's going to become reality here in New Jersey. A young person shouldn't have to worry about whether the world is going to accept them or not, or if there's a future for them. And so our goal is really to make sure that these bills don't even see the light of day, to protect with and stand with trans youth.
Thank you, JP and Christian. So a follow-up to that, what if I were a parent, and for those that are watching tonight that are parents, how can they advocate for their child in a school setting?
So you have a lot of resources available to you. You might not know of them, but you do have support. Each child, regardless of how they identify with their gender or with their sexual orientation, they have a right to be who they are in school. And not a lot of people understand that, right? So you need to know your rights. I can put a great link in the chat so that you can see your rights. And then unfortunately, it's up to you to advocate. So as a parent, your child's going to need help for you to advocate for them. But your child has the right to be out and be who they are in school without fear of discrimination, bullying, harassment. And if unfortunately they do face any of those things, you have a right to report that. The school then has an obligation to follow that and to investigate whatever's going on and to deal with it accordingly. Your child has the right to go to the bathroom that they want to go to. Your child has the right to be referred to by the name and the pronouns that they want to, regardless of what the legal documents say. So it's all a matter of just understanding your rights and then being there for your child and helping advocate for them. A lot of times people think that they don't have these rights. And there's a lot of misinformation being spread around there. So it's really important that you understand that your child has the right to dress the way they want. They have the right to be who they are, and that you as a parent need to help them navigate through that because it's probably not going to be an easy road, unfortunately, especially with bullying and harassment, as the other panelists were talking about how high the rates are. So I think the biggest thing to advocate for your child is for you personally to become educated, right? It's probably new stuff for you to hear, and you want to support your child. So the best way to start off with that is to understand the LGBTQ community, understand terms, really take it on yourself to educate yourself so that way you can help your child advocate as well. It shouldn't just be on the child to figure out who they are and then explain it to you and explain it to the school. Your child's really going to need your support. So for me, my program, Family Connections Pride Plus program, we actually have parent support groups. We have parent psychoeducation groups. We also do family therapy, so that way you can work with the family and really educate the family on what the child's going through and how to best support them. But that's probably the best way to advocate for your child. To know your rights is definitely the first step, and to go from there and just make sure you're supporting your child.
Thank you for that. I did want to ask each of the panelists, what resources does your particular organization provide to the LGBTQ community? And we could start with Craig and then go to JP and then round out with Christian. Craig, can you hear us?
Sure, I can hear you, sure.
Okay.
So for my organization, depending on what the need is, whether it's HIV, whether it's an educational need, whether there's a housing need, there almost always is a resource. And so I think you put in the chat section, there's a resource packet. And so we would refer to one of the organizations in the packet. And the message that I want to underscore is that you don't have to do this alone. There are many people to support you on this journey who are very knowledgeable. And we know that by having the experience of someone who has gone through this before, it's a very important and powerful experience to follow someone who has done what you need to do. And it helps reduce isolation and it restores your sense of confidence and trust. So in terms of any one specific organization, I don't refer to any one specific organization, but we try to figure out what the need is, and then we find the organization that closely matches it.
Thank you. JP?
So again, I work with Family Connections Pride Plus program. It's our newest program. It's a program dedicated to LGBTQIA plus youth and their families. So we offer individual, group, and family counseling. Also, I want to mention that all of our services are completely free thanks to a very generous grant from the Healthcare Foundation of New Jersey. So we are able to offer individual, family, and group counseling to LGBTQ youth and their families. We have specific middle school and high school support and psychoeducation groups. We also have a drop-in kind of time and center where youth can come, do their homework, hang out with peers, recreation events, and things like that. We also take the youth on field trips, and we also do community events with them, so that way they can get to know their community and become comfortable with their community, attend pride events, and really just be who they are, not only in our space, but also in their community as well. We offer these services primarily all throughout Essex County, but we are looking to expand as well as to provide services to elementary students as well. And as I mentioned earlier, we also are providing these services to the parents and siblings to really hone in that family support and make sure that the youth are supported by their family as well.
Thank you, JP. I don't think a lot of people are aware of your organization, especially when it comes to the services that you provide to youth. So thank you for giving a little bit more explanation around it. And Christian, I know that Garden State Equality is the largest advocacy organization in New Jersey, but can you speak to what your organization provides?
Sure, we provide a lot, but and yet we're a small team. I've been here for about 7 years, and I've not figured out a good elevator speech to explain to someone what Garden State Equality does. But like the best way I can say is we do a lot of policy work. We pass pro-equality laws, and the programmatic work that we do is in the education and health and wellness space, usually based around training and empowering youth and ensuring that folks in our community have the tools and resources to advocate for themselves. We've also prioritized lifting up diverse voices from the LGBTQ community. We saw, sorry, I was going to say something too political, but we know with pro-equality elected officials that more often than not, we advance the issues that are important to the LGBTQ community because LGBTQ people have a seat at the table. And much in part thanks to the New Jersey Division on Civil Rights for also always seeking community engagement, we are able to lift up the voices from so many different communities within the LGBTQ community. In fact, a lot of the language that we've been trying to shift to is talking about LGBTQ communities, because we are not one monolithic community. We are a community that is very diverse, that has different beliefs, and it's about establishing shared values, a shared value system among those many LGBTQ communities. And here at Garden State Equality, we then lift up those voices and concerns and issues to institutions of power. And so that's as much as I have been able to refine my really quick, what resources does Garden State Equality provide? And it's also a lot of what Craig was saying is, Google us, go to our website, send us a message on Facebook, Instagram, Twitter. If we can't help you directly, we are in a great position to connect you with local providers, whether that's individual therapists, attorneys, connect you with local community centers that do direct services. And we'll hopefully get you steered in the right direction.
Thank you so much. I want to shift and talk to Iris for a little bit. Iris has been I see it in her face, she's just been absorbing all the knowledge that you have been giving our attendees tonight. Iris, can you talk about DCR's role in safeguarding LGBTQIA folks from discrimination?
Yeah, it would be my pleasure. First, I want to just say, thank you for having me in this space. It's really great to hear from all of you and get this diversity of perspectives. I also want to elevate, of course, Christian's fine point that our communities are extremely diverse and that LGBT discrimination is going to look differently depending on your intersections with other identities, particularly race and age and disability and other identities. So I think it's really incredibly important that we think robustly about the discrimination that we face, right? And I also would be remiss if I didn't also elevate that all of these factors and dignity harms that all of our panelists spoke so beautifully on also contribute toward LGBTQIA folks living in the greatest rate of poverty, one of the greatest rates of poverty in this country, and that LGBTQ issues are poverty issues. So having just added those couple cents in, I'll turn to DCR and why I'm so happy to work at DCR and about the credible work that we're lucky and able enough to do. So for nearly 75 years, DCR has been enforcing the New Jersey law against discrimination. It's one of the most robust anti-discrimination laws in our country. The law prohibits discrimination and harassment in employment, housing, and places that are open to the public. So we at DCR stand ready to protect the rights of all LGBTQIA folks in New Jersey, whether you're trans, non-binary, third gender, gender non-conforming, or cisgender, or of another gender expression. You have the right to be treated consistently with your gender identity and expression. And regardless of your gender identity or expression or your sexual orientation, you have the right to not be discriminated against or harassed where you work, where you live, in places open to public. So what does that mean? Some of our panelists already hit on it, but that means, for example, that you cannot be fired from your job or subjected to hostile work environment for being transgender, nor can you be evicted or denied the opportunity to lease an apartment or denied repairs on your apartment because you're gender nonconforming. Similarly, places of public accommodation like schools, restaurants, government buildings, they cannot treat trans, non-binary, or gender nonconforming people differently than anyone else. So among other things, as JD pointed out, trans people have the right to use a bathroom or changing room consistent with their gender identity or expression, same as cisgender people and binary. And importantly, employers, housing providers, and places of public accommodation can't retaliate against you for asserting your rights under the LAD. So that's a lot. And now I'm going to just kind of briefly turn to some of the tools that we use. And there are a lot. But it's important for the public to know the tools that are out there so they know how to tap into and advocate for themselves. So first of all, we investigate allegations of discrimination or harassment. And we do this in two ways. One is that an individual who believes that they've been the victim of an act of discrimination can file a complaint with us. They can do that within 180 days of the act. This is really important. The complaint is free. It's like designed to be a user-friendly process. You don't need an attorney. If you do that, DCR will act as a neutral investigator in the process. So take some of the onus off of you, right? And they'll come up with a finding. So the other way that we do it, investigate discrimination, is that we investigate patterns and practices of discrimination. And it's actually the work of my unit, my work. We bring director-initiated investigations, and we'll bring complaints around against wrongdoers, and we'll hold them accountable under our laws. We are absolutely not afraid to use every single tool in our arsenal to make sure that LGBTQIA plus folks are protected. We also, of course, have a team of folks that are engaging in community. Tisha's part of that team. They will go in after an incident and help people kind of recover from that, and help them have the tools available and listen to them. So we also meet with stakeholders all of the time. It's really, really important that our work reflects lived realities, right? I might have an idea of what LGBT discrimination looks like from my professional life and also my personal experience, but it's not necessarily the same way it impacts somebody else. So we have to be hearing from you all about the things that you're facing. And two more things. We have a very robust educational program. All of our trainings are free. They're really, really, really great. They're educational, they're inspiring, they elevate human dignity and experience. And you can sign up for them on our website. They go into great detail about the LAD to level that I'm not gonna be able to do today. And lastly, we work on proactive policy initiatives. So we have a couple of documents on our website that y'all can tap into that will help you understand the LAD and the intersection with LGBTQIA identity. So under our resource page, you'll find fact sheets that are designed so that folks can just kind of like even carry them with them to a situation. You know, I have them here. You can't see it, but we have ones that are designed for people who and for folks in school, whether they're students or staff. We have ones designed for you as you navigate housing, places of public accommodation. So we also have a number of published reports that aim to also speak to the LGBTQIA experiences. You'll see in our bias incident report a number of summaries and contextualizations that have to do with that experience. So let's see, what else am I going to highlight? I'll highlight one other thing and then I'll pull back. So to highlight just one other example, we work on task forces with lots of really amazing stakeholders. For example, we participated in the New Jersey Transgender Equality Task Force and came up with recommendations about things that we could do better across New Jersey. And in fact, some of our one-pagers came out of a result of that. So those are some of the things that we do and the tools available to us. Yeah. And we're here and we're ready to utilize them.
Thank you, Iris. And I just want to let everybody know that the fact sheets that Iris spoke to are actually included in the resource packet link that has been dropped during the course of tonight's program. Iris, can you talk to some of the recent steps DCR has taken to address LGBTQI+ discrimination?
Absolutely. So I clearly just touched on a number of our efforts. And we certainly have more. So I'll just give you a few more and try to demonstrate kind of how robustly we're thinking about this work and how open we are to other people kind of sharing their perspective. You know, we welcome it. So DCR opened an investigation against Ernst & Young based on the company's training, which relied on gender stereotypes. And we determined that the company did in fact violate LAD's prohibition on employment discrimination based on sex, gender identity, gender expression. So in the agreement that we came to them with, there are a number of penalties, but one of the like really exciting things that we developed there was we were able to get a $500,000 scholarship program created to increase opportunities for employment in accounting and financing for women and folks of trans experiences and non-binary folks, gender non-conforming folks, intersex folks. So that money's specifically set aside to help develop people that are traditionally left outside of those economies, right? So I think that's a pretty awesome thing that we've done. We also worked with the AG to publish a directive on law enforcement interactions with non-binary, gender non-conforming, and trans people in late 2019. We recently provided feedback about New Jersey Civil Services Commission State of New Jersey. I have to read this one. Workplace gender transition guidelines. It's just hot off the presses. And we're often act as friend of the court in briefs about these anti-LGBTQIA measures across the country in these various lawsuits. We weigh in on them. And we weigh in often to say, hey, this is how this law that you're trying to pass in this other state is going to impact the kids in New Jersey. So those are just a couple of examples.
I know I kept pushing you because I really wanted you to talk to some of the excellent work we've done in the last couple of years, especially with the transgender task force and the fact sheets, and Ernst & Young, I think, was a huge win, especially for those trying to come into the finance industry. So moving on from that, can you tell us why it's so important for individuals to report acts of discrimination and bias-based harassment? And how, like, not only why is it important, but how can you report it? And I
Okay,
know you
so
spoke up a little bit about this before.
yeah, so first you can report it by going to NJ Bias. If you go to just Google New Jersey Division on Civil Rights, and we'll drop a link here, you can file a complaint. You can also email us at our general line. If you don't want to file a personal complaint, you just want to say, hey, I think there's a there, you know, and that will alert us and let us track it. So kind of before getting into why I think this is so important, I first want to honor and acknowledge that there are many reasons a person may not want to initiate a complaint, right? And that's particularly true for people that have faced institutionalized violence, people in our communities, and sometimes at the hands of government. So I think that that's important to honor. I know that sometimes you have to kind of address your immediate needs, food, shelter, right? Employment. So I don't think that I think that that's real. And I also am cognizant that addressing the indignity of discrimination and how it's played on your own life can sometimes open things up, even if at the same time it provides you with a sense of agency. So I want to honor that. So I will now say, now this is like my pushing point, that, you know, the process is intentionally designed, and everyone can certainly always get better, and we welcome feedback, but it's intentionally designed to be user friendly, to be something that you can do, right? We have really culturally competent investigators and legal specialists that really do strive every day to do right by the people we serve, right? And for like humanity at large. So the other reason is that while I mentioned earlier that we do take proactive steps to eradicate the cancer of discrimination, right? And it's certainly all of our goals to all be out of jobs one day. We can't monitor every situation. We can't be aware of every situation. So we can only enforce violations if we're aware of them, and we can't monitor every interaction. So when you file a complaint, it's an essential part of making New Jersey a fairer place, right? It allows us to hold bad actors accountable. It allows us to see patterns and practices, and it allows us to force bad actors to change their practices, right? To be more equitable, to find solutions and ways to honor everyone, right? So that's part of it. Like, part of it is a call to action. If you're safe, if you want to do it, that like you will be protected against retaliation. The law says that you can't be retaliated against, that by filing a complaint, like you are stopping wrongdoing, right? And there's a greater chance that that actor is not going to behave in the same way again once they're held accountable. And that others will go, oh, wait, this happened to somebody else that was doing the same thing that I'm doing. Let me reform my practice. So, you know, I think we're all in it together, and something that people can really, really, really do to eradicate discrimination is to file a complaint.
Thank you, Iris. Christian, is there anything you want to add?
There are like people in this state that I just take a step back and I go, we're so lucky that we have that person in New Jersey. And Iris is one of those people. There's nothing to add after that. The only thing I'll say is if you're a little confused on who to contact at the state, or you're a little uneasy about if they're a trusted source, feel free to reach out to us on our report discrimination form, and we'll steer you to folks that we would trust with all of the work that we do. Other than that, Iris hit all the points, especially the government related harm and needing to build trust between that system and our community, which is really what we're working on a lot more now than ever before. And we're making a lot of great progress, as we can see in the increase in reporting that's taking place from the LGBTQ community. It's the only thing I wanted to lift up. Nothing else to add.
Oh, thank you, Christian. So we've talked about so many things tonight. I really wanted to take some time and carve out space to talk about how an individual can become an advocate for the LGBTQIA plus communities. And we could start with Craig, move on to JP, And Christian and Iris, if you want to chime in.
I wanted to comment that there are lots of ways to be an activist, and being an activist can take a big step and it can be a small step. It can be loud and it can be soft. And so each person has to find their way to be a part of the change. And so if it means going to a rally, if it means writing a letter, if it means speaking to a public official, if it means talking with your family and friends, all those are ways of being activists. There's no one way, and everyone needs to do what's best for them given their circumstances. Part of the healing and part of being whole is speaking up. And speaking up, as I said earlier, is part of health. And so each person, depending on their circumstances, can really help themselves and help others to be part of the change that they really want to see. So I encourage everyone to reflect and to find a way to be part of the world that you would like to see.
Thank you, Craig. JP?
Greg, that was so beautifully put. I mean, for real, it's all about finding your strength and seeing what you can do, right? Not everyone's activism is going to look the same, but as long as you are doing something, right? And so again, like Craig said, that can look like a bunch of different things. You know, even people that are in the LGBTQ community that aren't out and loud and proud, right? They're still there, they're still valid. And the same goes with allyship, right? Just making sure that you are there, you are support, and you can help direct an LGBTQ person to any of the resources that you learned about tonight. Even that is a great, great difference that you can make in someone's life. When you talk about resiliency, it's about, especially with youth, it's just having that one supportive adult in their life. And as long as you're that person for them and you're helping them through whatever their process looks like, that's really, the best part of advocacy and allyship.
Thank you, JP. Christian, do you have anything to add, or Iris?
Yeah, I'll add this. What are you good at? Think about what you're really good at. Are you good at IT? Go do IT as a volunteer for a nonprofit. I promise you they need it. We have no idea what cable goes where. We know how to make a protest sign. We don't know IT. Are you good at designing and graphic design, and are you artistic? Then go volunteer for an organization that needs those services, whether it's social media graphics or designing flyers for an event. Are you big and strong and you're a tough person? Go to a rally and ask where they need a human barrier to stand to make people feel protected, right? Like there's always people at rallies and protests that are vulnerable. And so sometimes, we might be an ally to that community. We stand on the perimeter to keep people safe in case, there's people that want to seek harm. What do you like? Do you like sanitation work? Go volunteer at a Pride festival. There's plenty of trash to pick up. Whatever you do, whatever is your purpose in this world, whatever you enjoy, go give that to an organization, to a cause, to a community. You will be welcomed with open arms. We've never turned someone away who says, I want to help. And I don't know of any organization that's ever said that. And so that's a way you can be an activist. The other thing is, I know a lot of people will get an email, saying, oh, we have 24 hours left. We need you to add your name to this before, this timeline passes. And it's so easy just to delete those. But you'd be surprised when we have contact your legislator forms about an issue that we want legislators to know about. They really do look at all of the messages that come in. We get calls when we put these forms out because their offices are overwhelmed by hearing from so many different community members. And so we live in like this social media world where it's like not about our individual voices, because it's just a lot of like noise out there. Your voice matters. It has an impact, just like your vote has an impact. But don't scoff at me signing that online petition won't do anything. It has more of an impact than you think. because there are enough people out there thinking that won't do anything, that when people actually do something, it's recognized. It makes a difference. And it only takes about 30 seconds of your time, and it can pass a piece of legislation. It can change a local municipal ordinance. It can raise awareness about an injustice that has taken in a community, especially like in a school district. We're seeing a lot of local organizing and activism needed now more than ever. And I know this is one of the questions, and I will get to it when we move on to it. But local activism within local communities and school boards and school districts is so important right now, because there's a lot of pushback against LGBTQ youth and curriculum, and the change is not going to come from a statewide advocacy organization. The change is going to come from the residents and the parents and the guardians of that local community. So what am I saying? Your voice is so important. Do not hesitate to use it. That's how you can be an advocate.
So that was all just so beautifully said. I agree. I think trusting your voice, listening to like what you're good at, and that, you know, it can be revolutionary and bring about real change when you just honor your own humanity by seeing the humanities of others, and building community with each other, you know, based on love and respect. That's part of activism, right? We have to have joy, and we have to have community, and we have to have connection. And the other stuff, there are so many other ways to do it. But one way is to engage in local government, engage in your government, engage in your community, trust your voice, trust your ability to to rise to whatever, you know, the challenges. You will.
Thank you. So before we move on to the question and answer portion of our program tonight, are there any last thoughts that you would like to share with our audience?
I just want to say thank you all for coming. Sometimes, you know, being an ally or coming out or being who you are can seem like a really daunting process. But even by coming tonight is an amazing first step. So just being here, I really appreciate you all for coming. And again, there's an amazing resource packet. You could reach out to any one of the panelists. We'd be happy to talk about it further. This time goes by so quickly. But just thank you so much for coming.
Thank you, JP. And Christian, Craig, Iris, is there anything else you would like to share with our audience?
We're here for you. DCR is a resource. We're here to serve all the people in New Jersey for LGBTQ rights. I'm personally here to serve my community. That's why I do this work. So please don't hesitate to contact us and to be in conversation with us.
Thank you. Craig?
Yeah, just to remind you that nobody needs to suffer, that we are here. There is power and strength in numbers and affiliation. And as I said, our sense of security comes from a sense of belonging. So our communities are here for you, and there are many ways to stay connected and involved. Be love, show love, be the change you'd like to see.
Thank you. That was so beautifully said. And Christian, any last words?
You know, we're here, we're statewide. We are in all 21 counties, despite our headquarters being located in central New Jersey. We have a team that's dispersed across the entire state in all 21 counties. Yes, we're even in South Jersey. You know, we're down there more often than not. If you need anything, we're in your local community. We want to empower you. GardenStateEquality.org. We've got a lot of resources on there. The work continues. The work continues. There's more happening now than during the marriage equality fight. I know a lot of people come up to me at events and they say, I used to volunteer. You know, I went to all the community meetings for marriage equality, and we thank you for that time. We're doing so much more now. come get involved and see what we're working on. It's so important.
No, thank you for that. So we had a couple of questions that came in our Q&A. And just to remind our audience, please feel free to drop your questions in the Q&A for the panelists to answer. The first question that came in from Matthews. I'm a teacher in the public school and a trans man who transitioned more than 30 years ago. How can we make sure that our collective actions and processes in New Jersey schools ensure that a person's gender identity and expression for students, teachers, and staffs are always respected and honored? And I feel like we touched on this a little earlier, but if we can just really delve a little deeper, I'd greatly appreciate it.
I can address that. So thank you so much for sharing. A really key point is representation. So even you just coming forward and saying that is really, really powerful. You know, when it comes to trans people, often the word passing gets used. And so for those of you that don't know, it's when a trans person passes as the gender that they are trying to transition to, right? So for me, I have the privilege of passing as a cisgender male. When I walk down the street, people don't usually think I'm transgender at all. So it's really important for me to use my voice and to use my story to help educate others and to show people that I have rights, they have rights, and here's how we can advocate for ourselves and people like us and people that aren't as privileged to be in that passing. Or Iris did a great job talking about intersectionality that might have other identities that also make you know, it more complicated and have even less rights than the next person. But I think it's really important to have representation, especially from adults, to start having these hard conversations at staff development trainings and, you know, at parent, you know, HSAs and things like that, and making sure that there's resources for staff, for students in the schools, and that they know their rights and are able to just be themselves, really.
Thank you for that, JP. Craig, was there something you wanted to add?
Sure. I think an additional piece, just to piggyback on what JP was talking about, tolerating uncomfortable conversations. Sometimes we overhear comments that are derogatory or disturbing, and rather than staying silent, are there opportunities for us to address those comments, whether we're at a barbecue, whether it's in a hallway, in a school, whether it's in a lunchroom? Is there a way for us to address these comments in a way that doesn't shame or criticize, but informs? There's a lot of misinformation that's out there, and I think each of us can play a role, especially in school systems, medical systems, where these kinds of comments no longer are acceptable. But if we sit in silence and we allow those comments to go unaddressed, we convey the message that it's okay for those comments to be there. And I think we're working toward living in a world where it's no longer acceptable to have those discussions and to make those kind of comments.
Thank you, Craig. The next question that came in was, are you aware of what the curriculum will look like for this upcoming school year, since it is a new program that teachers will teach?
So I'm going to go first here. So this is, you know, an important conversation. New Jersey passed a law, I think it was 2 years ago now, 2.5 maybe at this point, that would require New Jersey schools in middle school and high school to teach LGBTQ inclusive lessons and resources. We were the first state in the nation to pass such a law. California's law was about LGBTQ history, which is important. But Jersey Pride, we were the first state for all relevant subject areas. What does that mean? That means in history, you might learn about political figures like Harvey Milk. In English class, you might learn about Oscar Wilde, James Baldwin, Langston Hughes, Audre Lorde. and learn about their identities. In a computer science class, you may learn about Alan Turing and how he cracked the code during World War II, and then how the British government, forced him into castration, and him having to face that despite, essentially stopping the war. And that's what we mean by all relevant subject areas. Now, Garden State Equality has developed curriculum in partnership with Make It Better for Youth that is free to every New Jersey school district. And the website is www.teach.lgbt. And there's a bunch of lessons and resources on there that any educator in New Jersey can download. And it was written by New Jersey educators who are often tasked by their own school districts to develop curriculum. This was not curriculum developed by activists with no education background. This was developed by New Jersey educators, which, by the way, New Jersey has the #1 public schools in the nation. So it's darn good curriculum. It is in line with, the Department of Education standards. It's really good. Go check it out, even if you're not in a school district, and read through some of the lessons that we put up on there. One of the issues is this is an unfunded mandate, which means that no one's really enforcing New Jersey schools to be teaching this curriculum. And New Jersey Division on Civil Rights is reviewing school districts that may not be in accordance with the law. And we are so thankful to all of the folks at NJ DCR. But we know from hearing from students and teachers that there are some districts out there that are not teaching this curriculum, or they're teaching it like bare minimum, right? Like, here's a book about James Baldwin. By the way, he was gay. And then they don't teach anything more about why is his writings about America that way? And what was he thinking as a queer Black man in America at that time? You can dive a little bit deeper. And so each local school district has the opportunity to adopt whatever curriculum they want. They don't need to use Garden State Equalities. They could purchase one from a big box curriculum company, which is often not great curriculum. But to answer the question about, are educators prepared for what we're going to be teaching in this upcoming school year? We've already been teaching it for a year here in New Jersey, and prior to that year, we piloted it for 6 months and got direct feedback from educators on what the curriculum, how it was landing with students, what it was like to teach it. We tweaked our curriculum at Garden State Equality, put it on this website, and now this curriculum has been being used in schools for at least a year now. And so some schools will be adopting more curriculum, some schools will be continuing to use what they use, and some schools may not be teaching as robust LGBTQ inclusive lessons and resources as other school districts. This is why all politics are local. Make sure that your local school boards are in support of LGBTQ inclusive curriculum. We know from data out of California that schools that teach LGBTQ inclusive lessons and resources, they have lower rates of bullying. Okay, because when other students see LGBTQ people in the lessons that they are learning, they go, oh, wow, my favorite author's LGBTQ. Well, that kid in the back of the classroom is not as weird now. I'm not going to bully them at lunchtime. And then when LGBTQ people see themselves in the lessons that they learn, they go, oh my gosh, I can grow up and I can be a computer scientist. I can grow up and I can, write one of America's greatest novels. And so it really changes the dynamic at a local school level. And I hope that I answered that question well enough. There's still so much to take place here, right? Armistad curriculum, which has been around in New Jersey for, I want to say, over 20 years now. It's still not, every school district doesn't teach it well, right? There's still a lot of improvements that are going to need to be made. And so the same is with LGBTQ inclusive curriculum. We're only in the second year. We're going to need to make a lot of improvements, but the feedback is always welcomed. And there's a lot of educators across the state that are members of Educators for Equality, a teachers group within Garden State Equality. And those folks can help you if you have local questions as well.
Thank you, Christian. I feel like that was a very detailed answer and really covered the whole scope. Our next question that came in was, I work in the Monmouth County mental health facility. Would love to know what our community needs, group, individual therapy, site clearance for medical transition.
So
I'm sorry, go ahead, JP.
So I think with this, it's really important to talk with the community that you're serving and see what they need, right? So for my program, we offer a wide range of services, but we really are, client driven. So if our clients that come to us and say, hey, we want to meet once a week and we want to meet as a middle school support group and we want to talk about all the things we experience in middle school, that's what we do. So I think it's really important to kind of see what specifically your clients need, and just making sure that your staff is competent enough to deal with LGBTQ issues, right? So, not only attending those trainings, but also putting those practices, those tips to use, right? If you're going to have forms that ask for preferred name and pronouns, make sure you're using those preferred name and pronouns. Make sure that you have gender neutral bathroom options, making sure that you have magazines or literature with same sex parents or resources for LGBTQ specific people. I know you mentioned needing letters. So you might, if you have a trans client, they might need, mental health letters to get gender affirming surgery or hormones in order to fit insurance. So that's definitely something you can offer. You can also become someone that does them for free pro bono. There's a list of a bunch of different clinicians that do that all throughout New Jersey, all throughout the country. So if that's something that you're interested in or can do, that is always greatly, greatly appreciated because not everyone has the means to access mental health resources.
There are two resources that I just wanted to make reference to, which are very helpful and available in most counties. One is PFLAG. I don't know if people are familiar with PFLAG, Parents and Friends of Lesbian and Gays, which is a very supportive organization that offers resources, parental support, family support for families dealing with a loved one with LGBTQ plus IA issues. And the other one is GLSEN. We haven't talked about GLSEN, and maybe JP, you would want make some reference to that, but GLSEN is a fantastic organization here in New Jersey, which supports educators and students who identify as LGBTQIA. That's a second resource. Many of the universities in the area have departments that are helpful, whether it's the psychology department, whether it's a student health center, there's a women's center, there are resources there. So you may also want to tap into those. Another one is Planned Parenthood. That's another organization that can be very helpful.
Thank you, Craig. And we have one last question that's come in. Is there any organization that can give medical help to those that need it, especially psychological help? And yes, that is what they wrote.
Sure. Many of the university hospitals do offer outpatient mental health services. Some of them have inpatient services. There's a whole range of services. So in terms of where one can receive both medical and mental health, most of the university hospitals do offer some services. So that would be one resource. Depending on the medical issue, so for example, if you have diabetes, if you have cancer, there are health-specific organizations also to tap into. So that would be another resource to think about. Which issue are you dealing with? Is it a sexual health issue? So there are health-specific organizations also to tap into.
Thank you. And I don't see any other questions in the chat or in the Q&A. So with that, I would like to take a moment to extend my deepest appreciation for the work that you all do to better the lives of LGBTQ folks, IA plus folks in the state of New Jersey. Many thanks for taking the times out of your busy schedules to join us tonight on this panel and give us such insightful knowledge on these different topics that we talked about tonight. I also want to remind everyone that there is a resource packet that has been dropped multiple times in the chat. The recording for tonight's program, the resource packet, and the agenda will be available on the DCR website. I also want to give a special thanks and shout out to the Community Relations Unit for their technical logistical support tonight, as well as the New Jersey Division on Civil Rights for their continued support on allowing us to bring this type of programming to the constituents of New Jersey. We want your feedback, so please, pretty please, fill out the program survey. Let us know what you thought about tonight's program and what other type of programs we could bring to you in the future. And also, if you haven't done so already, please feel free to register for the Division on Civil Rights Education and Training Unit's upcoming interactive trainings on understanding the needs of LGBTQIA plus youth. The upcoming trainings are August 18th, September 20th, and October 19th. Though the registration link can be found on the Education and Training Unit's landing page, which is located on the DCR website. So thank you for joining us, and until next time, have a great night, everyone.
Be well, everyone.
Mhm.